Welcome to the concept of quality improvement. Intro to quality improvement. We're going to go over Sentinel events, reporting and benchmarking, quality improvement cycle, so plan, do, study, act, and just culture. Outcomes, we're going to define quality, describe why quality is important in healthcare, describe why the plan, do, study, act template in quality improvement, describe the role of the nurse in quality improvement, discuss how Sentinel events are reported and how they are associated with the quality improvement, describe the process of benchmarking, and discuss just culture and how it's associated with quality improvement. Quality is the degree to which healthcare services for individuals and populations increase, like likelihood of desired health outcomes, and are consistent with current professional knowledge. Involves providing patients with appropriate services in a technically competent manner, using good communication, sharing decision making, and utilizing culture sensitivity. So quality has a lot of the different aspects of ethics and collaboration and all of those things as well. So when you're looking at something for quality, you're like, did I give that person their education in a technically competent manner? Did I use good communication? Did I let them have a decision in their care? Did I utilize culture and sensitivity? Quality improvement is a systematic and continuous actions that lead to measurable improvements in healthcare services and health status of targeted patient groups. So HRSA is who stated that. And this is like our EHRs. It was a quality improvement. We want everybody on Epic, right? Because it's standard across the board. Everybody sees everything, and it's improving patient health because of it. Quality management is the evaluation of nursing processes for quality and effectiveness compared to accepted standards. So these are to correct problems before they cause harm to patients and to prevent errors in treatment. So that's the scanning your patient's armband before you give a medication. This is one of our quality improvements. Aims to provide cost-effective care by preventing overuse and misuse and underuse of medical resources. This is where your Pyxis comes from. So you have to scan those things out and scan them back in if you don't use them, and that also helps keep costs down. What's benchmarking? So benchmarking is a method of comparing performance of a person or an organization to industry standards. So the standard of care is based on an established model of high quality performance. So it may reflect performance history of the industry leaders or scientific clinical research, recommendations of professional organizations, and we want to base our standards of care on that. We want to see if our standards are meeting those standards. The Donabian model of quality improvement is structure standards related to material resources, human resources, and general organizational structure. The process standards focus on steps used to lead into a particular outcome. Outcome standards focus on performance of a process. So we're looking at all of those different pieces and facets, especially in healthcare. Indicators, statistics that reflect organizational performance in specific areas. They're always looking at the stats. To compare quality of care to industry standards, we might be looking at other hospitals. They have something called a magnet status for hospitals, and that's a lot of hospitals have BSN requirements, and they're trying to see if that is something that they want to make a standard of care. So that's a way of looking at some of these indicators. They're looking at these statistics of how well their patients are managed. Must be measurable, objective, sensitive to changes in performance. Sentinel events. A sentinel event is an unexpected occurrence involving death, serious physical or psychological injury, or risk of injury. As quality improvement, we want to reduce the amount of these, right? But we now have a way of reporting and viewing these sentinel events so that we can learn from them. So they require immediate investigation and response. The Joint Commission reviews the facility's response to the sentinel event as a part of the accreditation process. So if they say the Joint Commission is coming, we are accredited by the Joint Commission. So therefore, we have to abide by their rules and make sure that this Sentinel event was reported properly. If Sentinel event occurs, the organization is expected to respond appropriately, this is part of reporting. The root cause analysis, problem solving to identify the root cause of the faults, plan to reduce future risk of Sentinel events, improve in implementation, and monitor effectiveness of these improvements. So, for example, let's say someone falls and they get seriously injured, they have a brain bleed. The hospital is going to report that issue. We have to report it in our chain of command. Okay, hey, we had a fall, and then we have to fill out the report for a Sentinel event, and then from the hospital it has to go to the Joint Commission or whoever is their accrediting body. Okay, and then from there we have to plan on how we're going to reduce this risk of falls. Okay, so we're going to have sitters, or we're going to have any patient with a Braden scale over this or that, with a fall risk over this or that, we're going to have their bed at the lowest position and their bed alarm on. And some of those are standards, but they might not be happening on those particular units. So then we have to improve that implementation. We have to make that a policy, or we have to make that something that's happening, and then we have to monitor the effectiveness. So all nurses, including nursing students and practicing nurses, must report. So if you find something, oh crap, then yes, we have to report. Never perform an act as the nurse is unsure how to perform. So if you don't know how to do it, please find somebody that does. Show accountability for his or her actions. Admit when their errors did occur. I really didn't chart that. Yeah, maybe I should have done something different, or maybe I shouldn't have put that bed at the bottom. I should have, I really should have put the bed at the lowest position. I shouldn't have just left it up. Know the facility's policies and procedures and follow them exactly. Follow them to the T as long as you can, and that's going to help you if you would ever have to be at a board. Understand how to report errors. So the paperwork must be completed. Individuals who the errors should be repeated to, that's where the paperwork needs to go. And the nurse must follow the chain of command for reporting. What is just culture? Just culture attempts to balance a blame-free environment with appropriate accountability. So it focuses on modifying actions, processes, and other things that lead to unsafe behaviors. Instituting a zero tolerance for careless behavior is part of this just culture. It differentiates between at-risk, human error, and reckless behavior. Understanding that the system failures are often a source of these errors, and we understand that error prevention is impeded by an atmosphere of punishment. So, we're not going to report errors if we think we're going to be punished by it for them. Focuses on the system while preserving individual accountability. So yes, this is what we need to do as a system. For this individual, you have to be accountable for your piece. Requires acceptance by management and individual employees. So the quality improvement cycle is plan, do, study, and act. So in the planning stage, you're going to define your goal. You're going to collect data, and you're going to outline a strategy. So let's take our fall patient. Reduce falls will be our defined goal. We're going to collect data. How do we reduce falls? Let's look online. Let's look at what other hospitals are doing. Let's look at the research. How do we best reduce falls in these types of patients? Outline a strategy. Okay, so we are going to put the bed at the lowest position. We are going to put our call bells on. We are going to, beside the bed, but within reach, we are going to put the bed alarms on. Do. Now we're going to have everyone do it. Let's go ahead and implement the plan. on a small scale. Let's try it on this floor first. Okay, then we have to analyze the outcomes. We haven't had any falls in a couple weeks. So maybe these implementations are working. And then act, whether we decide to meet the goal. So in case we would go ahead and yes, we're going to implement this as a standard for our facility. So, and then because it reduced falls. Thank you for listening. Have a great day.